All right, officers, let's jump right in. This is your essential training explainer on Senate Bill 43, and more importantly, what it's going to mean for you out in the field. Look, we've all been on that call. The one where you're with someone who is clearly, and I mean clearly, a danger to themselves. But because they technically have some form of shelter, your hands are tied. It is an incredibly frustrating spot to be in. Well, that exact gap is what SB 43 is finally here to address. Okay, so here's our game plan. We're going to quickly cover the old challenge, then dive into the massive shift SB 43 brings. We'll get practical with your new field toolkit, talk about why partnering with behavioral health is so crucial, and then wrap up with the go-live date and resources for us here in Merced County. First up, let's talk about the old challenge. We got to quickly recap the limitations we used to face, because you really need to understand where we're coming from to see just how big of a deal this change actually is. You know, the old law was it was so restrictive. Our ability to intervene was tied directly and only to those three basic things: food, clothing, and shelter. And that's what led to all those heartbreaking calls, the ones where you could see someone spiraling, maybe refusing life-saving medical care. But because they technically had a place to stay, there was nothing we could legally do. Our hands were completely tied. So that was the old way. Now let's get into the SB 43 shift. And I want to be clear, this is not some minor tweak to the law. This is a fundamental change in how we assess risk and when we are able to step in and help. It's a new reality. This right here, this is the absolute core of the change. We are pivoting away from that old, rigid model of food, clothing, and shelter. Now the focus is squarely on a person's immediate health and safety. And here's the other total game changer. SB 43 explicitly brings substance use disorder into the definition. That is huge. So let's just break this down. The focus is now on health and safety, not housing. It now includes severe substance use disorder. And get this, it applies even if the person has access to food, clothing, or shelter. This allows us to intervene earlier based on real-world risk and to finally address those nuanced, life-threatening situations that used to fall right through the cracks. So, what does this actually look like for you on a call? How does this change your mental checklist? Okay, let's get practical. Let's talk about your new field toolkit. From now on, your evaluation process is going to feel a lot more diagnostic. Instead of just checking the box, do they have shelter, you're going to be guided by these three key questions. Can they manage their own health? Are they refusing care because of their disorder? And is their judgment so impaired that they're a significant risk to themselves? These questions get to the real heart of the matter. Let's walk through a classic example: medical self-neglect. You've got someone with schizophrenia and severe diabetes who thinks their insulin is poisoned because of their delusions. They keep ending up in the ER. Under the old rules, if this person had an apartment, getting them help was next to impossible. But now, this qualifies. The intervention is based on the clear medical necessity. Why? Because the mental illness is the direct cause of them refusing life-saving care. That is the new standard. And here's that other huge shift we talked about. We've all seen this one, right? The person with a severe SUD, repeatedly overdosing, getting revived, and then going right back to the same behavior. This law finally acknowledges that a severe addiction can literally hijack a person's ability to preserve their own life. That pattern of self-neglect, where their judgment is just gone, that now meets the criteria for grave disability. Now, this new authority, it comes with more responsibility. That's a given. But here is the good news. You are not expected to make these tough calls alone. In fact, you really shouldn't. So why collaborate? Let's just be crystal clear about this. Partnering with the clinical experts at Merced County BHRS and the mobile crisis teams, it's not just some extra step. It's an absolutely critical component for making decisions that are legally and ethically sound. They are, without a doubt, your strongest asset in the field. I mean, think about what they bring to a scene. They provide that crucial clinical insight that you need. Their assessment strengthens your documentation and makes your justification for a hold rock solid. They're experts at de-escalation, and honestly, it spreads the burden. You're not shouldering that incredibly complex decision all on your own. Okay, if you remember one thing about your report writing, let it be this: the direct link. This is everything. The legality of the entire hold hangs on this. It's not enough to just write person has SUD and is a danger. No, you have to clearly articulate how the disorder directly prevents them from caring for themselves. For example, due to active paranoid delusions, the individual believes their insulin is poison, which directly prevents them from taking their life-sustaining medication. You have to connect those dots. All right, let's bring it home. We're going to wrap up with the most important practical information for you here in Merced County, when this all takes effect, and exactly who you can call for help. Here's the date. Mark your calendars, put it in your phone, January 1st, 2026. That is the official date this new standard becomes part of your toolkit here in Merced County. So I want you to think about this. The goal here isn't just about more holds, not at all. It's about making smarter, more informed, and more compassionate decisions. This law gives you a tool to finally intervene earlier and prevent a catastrophe that before now you were legally forced to just stand by and watch unfold. This is a chance to make a real difference. And remember what I said, you are not alone in this. Here are your key contacts. I am telling you, take out your phone right now and put that BHRS 24/7 crisis line in your contacts. That number is a critical lifeline when you're on a complex call and need that clinical partnership. Thank you for your time. Stay safe out there.